good news is that most aneurysms don't need surgery, at least in our clinical practice. And that's a really nice thing to be able to tell patients and their family, because if they've been given this diagnosis by a cardiologist or an internist or a radiologist, they're coming to the office pretty anxious about, oh my goodness, I have this ticking time bomb that needs surgery. Probably 90% of patients that we see don't need surgery, but everybody needs some very good advice and needs a specific evaluation that is really specific to trying to tease out extra elements of risk that might change their status within the guidelines. Patients who don't need surgery, the specific advice that they need is to learn about activities that might trigger an aortic event. And what that means is that if you think about any dilated aorta or aneurysm or any tube you can imagine, they all have a breaking point, right? And that breaking point we relate to a particular blood pressure. Most people would be very surprised to know that us humans can get our blood pressure up to about 450. Those blood pressures that could provoke a rupture or a tear, they're extreme blood pressures that are usually triggered by something that we call Valsalva activities. Valsalva is a Latin word and a medical term that basically relates to straining, okay? That basically makes us do something that involves breath holding and something strenuous at the same time. And that can be probably the simplest example that every doctor tells the patient is about heavy lifting. But if it were as easy as just not lifting a certain weight threshold, anybody could give this counseling. It's much more nuanced than that. One example that I love to give to men in particular is if they've ever seen their spouse or on TV, a woman delivering a baby in live childbirth, because that is a great example of Valsalva and extreme straining when the pregnant mother is trying to push out the baby. She's not lifting anything heavy at all, but she is pushing internally, right, with a tremendous amount of strength and might. We also give their doctors some advice on some things that are not necessarily forced by the guidelines, some things that are still early in research phases, some medications that they might be on for blood pressure anyway, to pick a particular type of medication that we know has an extra effect on the molecular level that might slow their aortic growth. And of course, these people need to be monitored throughout their lifetime in a surveillance program like ours, because we don't expect the aorta to stay at size X on the day that we saw them. We actually expect these aortas to grow over time, and some of them may grow up to a size that would require an intervention according to published guidelines. But it's important to never forget that you have this, because you have to be very careful about those activity restrictions for your entire life.